one of the key points with the MITRA-FR trial is that it's one of 3 trials that we are going to see results on in this field. So we have MITRA-FR now reported. We'll have COAPT at TCT in just a few weeks, and the German Reshape heart failure trial will be a 3rd one that's almost completely enrolled now. So we're going to have a kind of increasing data set on this problem of functional MR and what is the impact of MitraClip compared to medical therapy. MITRA-FR, disappointing certainly that it's a negative trial, but this also highlights the challenges in studying this population. So MITRA-FR randomized 300 patients. There was a substantial dropout and crossovers in both directions through the course of the trial. And I think this illustrates that to have adequate numbers of patients to look at subgroups to find signals is a very important piece that we don't have yet. COAPT, of course, is over 600 patients, so we anticipate a much greater potential, whatever the major endpoints tell us, to look for which patients do or don't get the most out of this therapy. We can look back, Everest 2 was a smaller trial, historic at this point, comparing MitraClip and surgery. And there were enough treated patients to get signals, in fact, that the FMR patients got particular benefit out of the therapy. And that's a big part of what has driven both clinical practice and our trial sequence since then.
Or MITRA-FR, I think, leaves us with more questions than answers regarding the reduction of mitral regurgitation in patients with heart failure. It is a negative study. It doesn't endorse the use of percutaneous mitral valve repair as a treatment for secondary MR in heart failure patients, but it is a rather small study, and there are bigger studies yet to come. There are 2 very important ongoing trials that address the same question addressed by MITRA-FR. The COAPT study, which will report in just about a month at the TCT meeting in San Diego, and the Reshape Heart Failure 2 trial, which is currently in enrollment. Both of these trials are substantially larger than MITRA-FR and will add to our body of knowledge regarding the efficacy of mitral regurgitation reduction for secondary MR and heart failure patients.